I want to talk about Medicare for all. If you don't listen to the whole video, just listen to this part because I think you need to hear it and I think other people need to know. Um, so, Medicare for all, if you're looking for something to support, that literally just is the idea that everybody deserves equitable access to healthcare and nothing else, nothing hidden, no secret agenda. That's what you need to support. We have all these other alternatives like universal health care or Affordable Care Act or primary health care for all. Think of these phrases like brands. You know, when you go to a fast food restaurant and it says blah, 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 1/4 pounder, and you look at it and you're like, this isn't a quarter pounder, but it is. That's the name. It's got the little copyright symbol on it, right? It's not that it's an actual quarter pounder, but that's what its name is, right? And that's how you need to think of all these other things. Medicare for all, M4a, is the one that you want to focus on. Universal health care, it sounds great as words, but if you actually look into what it argues for, it is not equitable access Medicare for all. All the other ones is the same thing. They're proposals that still feed into the system that we still have, which is about insurance companies profiting. You never know when something like horrible is going to happen that's going to change your life forever. And if you can't afford it, now you can no longer be a productive member of society because you can't work to your full capability anymore. And it's something that could easily be fixed if medical care wasn't a financial stress. I make the argument that everybody should have the equitable rights to be a productive member of society. Everybody should be able to contribute to society, and that's what Medicare is. How many people aren't working at their highest efficiency because they got back problems, they have knee problems, they have headaches all the time because they have poor dental health and they can't afford going and getting looked at and having their problems solved, so they just live in pain, right? And how many people, quote unquote, take advantage of the system and don't contribute to it versus the ones who do contribute it and would benefit from it? But we want to say, no, we don't want to do this because of the 5% or whatever group of people who don't contribute, who are leeches. Nobody should force you to take care of other people, but you should want to take care of other people, right? You should want other people to care about your family. And you should want to care about other people's family, the extension of self worth, seeing other people as people, seeing other people who have who go through the same suffering, the same struggles, the same health issues as you do, who are also working class people, who have spent their whole life contributing to society and working hard and investing sweat and blood. You can leave now if you don't want to hear the rest, but that was the most important thing, is that Medicare for all, that's the one. Ignore all the other ones. Medicare for all is supported by the National Nurses United. I just was informed about this because I was confused and I was throwing around universal health care like it was a good thing. It's not. I mean, it's an okay thing, but if you look at all these things that are being proposed, the amount of work to implement all these things, the one that would do what everybody wants it to do and you wouldn't ever have to go back and change anything is Medicare for all. On the subject of linguistics and presentation, right? We need to be careful of things that are presented in a way that are to create conflict because there are brands. I'm going to call them brands. They're copyright, right? Because the words themselves are good, like universal healthcare. Nobody wants to say, I don't agree with universal healthcare, right? In the same way that nobody wants to say, I don't agree with diversity, equity, and inclusion. The words by themselves are positive. I would make the argument, right? However, when you take those words and you put them in quotes and you make it into a proposal or a system of things, it is no longer just the meaning of those words. And so now you have two different perspectives. You have the perspectives of the original intention of the words and what they mean, and then you have the perspective of what that program or whatever actually does and actually supports and actually advocates for. And this is not on accident. This is on purpose. It is to take advantage of your mind because your mind says, that seems like a great idea. I love that name. That's the power of symbology, right? It wants you to support something that has a good name, and it doesn't want you to do too much research into it. It wants you to believe that people at foundation have good intention, and that when they pass things like this, there's nothing hidden. There's no read in between the lines, or little paragraph at the bottom that's super tiny. And we want to just believe in these names. Well, nobody wants to waste their time and resource going and looking up these 50 different, healthcare alternatives, that are all just designed to confuse you under the guise of, oh, we're on your team, we care about you, right? Because at the end of the day, what was the first one that was proposed? You had that first one that was proposed, and then you have counter proposals. Why? The counter proposals are ones that they want people to think are for the people, are good for them, because the counter proposals are the people that people do not want to negotiate on, that people do not want to allow. And at the end of the day, Medicare for all does not benefit insurance companies. And anything else that's tied to health. And think about it, if you had Medicare for all, think of what other insurance companies, you would no longer have to pay for medical obligation for, like, if you got into a car crash for you or the other person. You don't have to worry about paying Medicare. Corporations don't have to worry about getting Medicare, right? You don't have to worry about getting renter's insurance to cover if somebody accidentally steps on a nail in your property because they're not paying attention, or worry about if somebody's trying to rob you and falls through their house and breaks their ankle, because you didn't have a good roof or whatever. All these other exploitative measures, right? I'm not saying it's going to make them immune, but it's going to be a whole less of a lot headache, because if you think about all the things that Medicare ties into, workers' comp and all that stuff, you no longer have to worry about that. You no longer have to worry about paying for dental insurance and health insurance as two separate things, which I've always never understood. Why is one, dental insurance, separate from health insurance? Because you can die from poor dental health. But two, that typically dental health options are always trash, and you still pay a crap load of deductibles, even though you're paying for insurance already.